Good afternoon. Good afternoon, everybody. Okay, we are about to start. So can we get settled as we start this program? This is the ELAB preview. Today is the 23rd of June, 2022 at the John F. Kennedy Medical Center Grand Rounds Hall. And I'm your MC, Dr. Batekwa. We are starting at this time. So first up, we will have welcome remarks, and that will be done by Chelsea Plyler, Project Director, Bridge U, Liberia.
Thank you so much. Thank you. Good afternoon, everyone. I'm really excited to be here today. I hope you all are too. I hope it's an inspiring afternoon. Welcome to all. Especially thank you and an ironic welcome to our hosts, the administrators of John F. Kennedy Medical Center, especially the Deputy CEO, Dr. Sia Kamaner. Welcome to all other officials of the government of Liberia from the Ministry of Commerce and the Ministry of Health. Welcome representatives and members of the Liberia Medical and Dental Association and the Alumni Association of A.M. Dogliati School of Medicine. Welcome officials of the Health Professions Regulatory Boards, officials of UBA, United Bank of Africa, and the United Methodist University. And lastly, welcome and thank you to officials of the government, the University of Liberia, specifically, and the Bridge U Applying Research for a Healthy Liberia project. As was said, I'm here standing in front of you giving these welcome remarks because I am the project director for this Bridge U Liberia award that is helping to realize the vision for the Experiential Learning and Assessment Lab, or the ELAB, which is the reason we're all here today. But in giving these remarks, I'm really representing a great many people, because something that's special about this initiative, the ELAB, is that it's a confluence of many different efforts on the part of many different partners. I mentioned before LMDA and the Alumni Association. We can thank them as really having been the starting point for the mobilization of resources, aka fundraising, that is making the creation of this space possible. Many of you I know participated in those fundraisers a couple of years ago, and what we see happening on the campus today is directly funded by donations from LMDA and AMD Alumni Association members. We're very appreciative of that. Building off of the momentum and the vision that LMDA and the Alumni Association helped to start, there were some investments made using funding from the US PEPFAR through the Resilient and Responsive Health Systems Project administered by HRSA agency here, but we're also grateful for those investments, which allowed us to buy a few pieces of high value equipment that you'll hear more about in the presentation as well. Now this only after all of that momentum and planning and resource mobilization has the Bridge U Liberia project come in to help further implement the plans for the ELAB. We also have to recognize the central role played by the Ministry of Health in both helping to build out vision for the simulation center and also in sourcing many pieces of equipment and supplies that will be used there as well, with both World Bank funding and some donations from another organization called Nurse to Nurse. So I might be talking too long, but I felt it was really important to acknowledge this great meeting of efforts, different organizations, different sources of funding that have all come together to make this ELAB possible. And of course, that coordination only works because there's such a strong vision for what this simulation center could be, what the role of simulation can and should be for clinical training here in Liberia. And for that, we have to thank many of the people I've already mentioned, including Dr. all around the vision of what the ELAB will be, and also inspire us to push harder to make that view a reality. Thank you all.
Thank you, Chelsea. At this point, we will now have a presentation on what the ELAB is about. And this is the introduction to the ELAB. And this will be done by Dr. Hawa Kuhn, Deputy Director, and Mr. Isaac T.R. Dolo, ELAB Coordinator, University of Liberia College of Health Sciences.
Good afternoon, everyone. Over the next few minutes, along with my co-presenter, Mr. Isaac Dolo, we will do our best to give you all the information you need to know about this ELAB. And the ELAB is the abbreviation is Experiential Learning and Assessment Lab. To turn it around is learning and assessing with experience. So you're going to use experience to learn and also assess. So let's go through. So to begin this presentation, I will start with my home, Liberia, my beautiful land. So initially, way back before I was born, reading history says that we had one of the best medical schools. And we had training of both national and international staff, doctors being trained at the medical school. We also had a very good hospital where we are now, and it is still good. My CMO is here. So, So during that time, our health system was blooming. We had a lot of doctors. Most of them were not Liberians, but the health system was providing the standard of care. But crisis came back by that struck the health system. We had the Civil War that lasted so long, and the war destroyed more than 90% of the infrastructures we had. Also, the health workforce, it was estimated that we had 3,500 plus, and the war reduced it to 1,400 around there. So there was a serious reduction in the number of the health workforce. Some died, some left. But the war alone wasn't enough. Ebola came. And Ebola was said to reduce our workforce by 8%. And we were directly linked to some of our professors that died. This was sad. But after Ebola, COVID also came. So the health workforce has struggled going through all these crises over time. But once the health system is shaking, there's going to be some of the disadvantage that's going to show clearly because of that health system that is affected. So preventable deaths gradually begin to increase. And some of the things that the skilled health professionals were catering for, now it was the other way around. We were seeing things that we weren't seeing before. Looking at the upsurge of our preventable deaths, what is needed to get these numbers down? So if we look at what is actually needed, our medical training requires a lot of skills. We cannot do anything without skills because I'm sure more than 80% of those sitting here are health workers. So it's skills that we use to be able to provide services. And these are not just ordinary skills. These are highly specialized skills that are unique to our service provision. So to get preventable deaths down, we need to improve the skills of health workers. Research has shown over time that to improve skill, you need a lot of practice. It has shown that knowledge, like critical thinking and exact psychomotor skills, like maybe you are opening an IV line or assessing for shock or what, those things required repeated practice. And when you practice over time, you have the ability to be able to perform those skills. And that ability to perform the skills brings about competence. So you find out that once you identify that health workers need these specialized skill, you provide the avenue so that they get that skill, and the environment is there so that they do that skill repeatedly. Over time, we will get competent and confident healthcare providers. Do we have the workforce? I think so, because following the war, there has been a lot of training organizations or institutions that have been added to what we had initially. We only had UL, Cottington, TNIMA also came early, but the Seventh-day Adventist University, the United Methodist University, SMART, all those other training services that are training health providers came by later on. So the numbers have increased. But the next question is, what's about the competency? What's about our own confidence? How is it? To give my own experience, when I completed medical school, I was assigned in a hospital. I was like I'm a doctor now and I'm wearing white coats. I'm in a hospital. People are looking up to me. But truly, it was just a show. Within, I was praying that I don't have patience overnight because I was truly afraid that I might encounter something that my confidence, I wasn't efficient to be able to manage it. Most often, I have a colleague that was working in JFK, Tatok Balon. I told her, any hour of the night, I will call you. Once I see something that I'm not comfortable with, we have to manage it through the phone. So I entered the clinics with a lot of uncertainty. I entered the clinics knowing that I did not have that confidence I needed to make me to lift my head up high. What's the secret? What gives health workers that competence and that the confidence to be able to enter the hospital? And patients also know when the doctor or the nurse or the physician assistant or the whatsoever does not have that confidence in themselves. The patients also get that signal somehow. So the next is we need the word simulation. What is simulation? You want a health professional to get a skill, but they need the environment for that skill to be learned. So the simulation provides, and mind you, when you want someone to learn a skill, or if I want to teach my daughter to wash dishes, I cannot teach her by giving her a pen. I need to take her to the kitchen, take the plate and the sponge and the soap, and train her through that. And repeatedly over time, she learns that. The simulation provides that environment so that health providers or learners can have that environment. The environment should be like a hospital. It should have the look, the IV stands, the sound that you have in hospital. It should have everything that when you enter, you orientate your mind to the environment as I'm in a hospital. The next thing is, after you have the space, that space needs to be converted to a way to teach. That's simulation education. Simulation education is using that environment, the lab, to teach so that your learners can learn, and you can also use that space to assess your learners. So let's say you have a particular skill you want to teach. Let's say shock. You want to teach someone how to revive their patient when the patient presented in shock. If I just took them to a classroom, the image that it gives, the interpretation and the understanding is not going to be like if I place them in an environment that looks like a hospital. So the simulation education is teaching, learning, and assessing in that environment that is close to the ideal. So what happens? When a learner comes in, they come in, as I just learned the word, they come in unconsciously incompetent. So you don't even know that you are not competent. So it's double negative. But that learner is relying on you to take them uphill with the level of competency. So when they come in unconsciously incompetent, it is the facilitator or the teacher duty to assess that level and take them from one level to the next. What this simulation does, it takes the scenarios from the clinic, because if I'm in the clinic and I know that someone might get choked on a peanut and my doctor I'm training needs to learn this, be able to displace that peanut from the airway, I present that in a scenario so that while I'm teaching you in a skill lab, I'm bringing scenarios that are close to what I actually see in the hospital, and you learn based on those scenarios. So it's easier for the learner to conceptualize the entire process of teaching in the simulation lab. Other than providing the clinical scenario, and you drill the learner through the steps, and we'll do a short demonstration to have an idea on the steps of transferring the skill, you have to give the learner feedback. As you teach them, you have to identify if they understood you. If they did not understand, you identify the gaps, and it's your responsibility to fill that gap in the simulation lab. So if he is demonstrating something and he made an error, you will not rebuke the person. You're going to take your time and you're going to let them know the good they have done, the positives, and then what they didn't do right is your responsibility to guide them to do it the better way. Also, there's a part that is called debriefing, where they reflect after the skill, after you have given the feedback. The learner also has to self-reflect on what they just did and then understand the errors they made. And the simulation lab that will be shown a little better by the next presenter will have a recording, video recording, so that the learner is able to look at what performance they just did and visualize their own error and be able to make changes. So we are talking about a state-of-the-art simulation lab. There has been a lot of studies, and a study was conducted for nurses to determine the impact of simulation-based education on nurses' competence, their confidence, their knowledge. So the lecturer, the method they used was to provide the didactics, taught the nurses, after which they did a simulation, and then they did a survey. And it showed that it improved confidence, it improved knowledge, it improved performance of these nurses. You know, as Dr. Dan said in the opening of this program, of these activities, every patient, I don't care how nice that patient is, will get tired if a learner has to practice on them repeatedly. And we learned that you need 24. Sorry, I just did a code, so I'm missing the answer. We learned that you need 24 experiences or 24 practice sessions to gain competence, to leave from being unconsciously incompetent to be consciously competent. So no patient is going to wait for 24 times, and we have 50 students in a class to practice, to build this competence, to build competency. Therefore, the simulation lab is the place that the learners are going to be comfortable with. They have the mindset that we have a place to learn skill, and they are going to go there intentionally to learn skill and acquire the different skills with the help of the different faculty. So simulation turns knowing. Simulation turns knowledge to doing. Simulation turns your knowledge to actual experience. So we'll take a short video, just 3 minutes, just to
Medicine all round is always very humbling, any kind of skill you may fail at. And this provides you with let me relook and retry in a different safe environment. And when I go to the patient, I might be more optimal.
There need to be a level of competence, and we can provide that with simulation. It has now been 21 years after we opened the initial skills lab.
That history has been brought forward as a result of the strong push to ensure that students are able to train in safe and protected environments.
This space boasts state-of-the-art teaching venues equipped with interactive whiteboards, room cameras, as well as tilt zoom cameras to capture high-definition videos.
The definition of high fidelity would be that you are allowing the learner to immerse themselves into a realistic situation, and that's where our mannequins come to play.
You can practice intubation, so then you'll have a head with lungs that you can practice putting the tubes into the correct place.
The mannequins can react to a drug that has been given. They can change their vital signs, what we call their blood pressure, their respiration rate, etc., etc.
And it also reduces the performance anxiety that our young medical students usually have.
And the confidence has been built because I get numerous sessions to actually come and practice the skills.
I think one of my favorite things about the Skills Lab is having the opportunity to practice real life-saving emergency procedures in an environment where we won't compromise ourselves or the patients.
But the big part of learning in simulation actually takes part in debriefing. It's got to be a safe environment.
Medicine and clinical medicine is not just about making a diagnosis. It is the way that you speak to the patient, the way that you obtain a history, and also the way that you convey diagnosis and often bad news.
One of the methods that we commonly use is peer-assisted learning for the training of clinical skills for our junior undergraduate medical students. This method is very effective in that it's mutually beneficial for both the student learners and the student teachers.
Now that I've started with clinical practice, I can see the full value that the Skills Lab has provided me with. The simulation experience has given me tremendous confidence in the real-life clinical situations.
So we look forward to this very exciting journey that we're on and to changing and shifting the way in which health professions education takes place here at the Faculty of Medicine and Health Sciences.
Very much, Dr. Kuhn, for that presentation. We want our learners and faculties to enter the simulation lab unconsciously incompetent and leave consciously competent, right? So we say, what is the future of simulation education in Liberia? What do we think about it? How can we go about it? What's the way forward? How can we sustain it? So the ELAB, as she said, the Experiential Learning and Assessment Lab, we have a very big vision. The vision is to have a state-of-the-art simulation center where we can have our trainees and our faculty coming to learn. And in the nearest future, we have our neighbors. We have people from the sub-region. We have people from West Africa, from the entire Africa, coming to us to practice. So our vision is a cutting-edge lab. It's not the normal lab we've had over the period, the normal simulation laboratories. This is a state-of-the-art laboratory. How can we do that? We need to do that by having evidence-based education. During our opening program, one of the speakers said he went to libraries, he went to schools, and he saw books and microscopes that were way dated in 1940s, 1930s. So it was like, are we practicing evidence-based education? Are we teaching, are we learning evidence-based education? Because you need to have more than knowledge, skills, and attitude. You can have the knowledge, you can have the skills, like Dr. Kun said, but you're not confident, you won't do it. You won't practice the skills. You can have the knowledge, you can have the skills, and you do not have a good attitude. You are not up to the task. You can be well knowledgeable, you know everything, but then a patient comes to you and say, oh, I have been having diarrhea for 3 days. You'd be like, you sure you've been having diarrhea? You don't have any sunken eye, dry lip, and what have you. And then from that point in time, you are skillful. You have the knowledge, but then that attitude, that clinician attitude, clinician-patient attitude, you don't have it, the patient won't say anything further. The patient will just give you a lot of clue, and the response is yes, no, because of that attitude. So you have to be competent, and not just, and the competency has to do with your knowledge, skills, and attitude. The three must go together. You need knowledge, you need skills, you need attitude, a good attitude. To not also learn it, but to improve patient care in our Liberia health system, improve patient care. There are a lot of us clinicians, we've been working for 10, 15 years, and we're still on those same old skills. We read a book, yes, but we do not practice. We do not have the hands-on. That's the reason why today we will be having the ELAB, because you need to not only practice while you learn back, you need to improve your skills. What you learned 10 years ago, the students coming today, it's a bit different. So you need to read, and you need to come back to this state-of-the-art simulation center and refresh yourself. We are hoping that in the near future to do the continuous professional development, we can use these refresher trainings and skills performances to renew our licenses. Because we know we are health workers, we renew our licenses maybe 2 years, 3 years. But are we checking our skills before renewing license? So these are things that we're thinking about doing in the near future. So to improve patient care, you have to improve your skill. Your skills, your knowledge, and your attitude need to be improved. Hence, patient care will be improved. So the ELAB will train doctors, nurses, pharmacists, midwives, PAs, both doing their pre-service and part of their continual professional development, like I just said. Before you enter the actual hospital, you will be trained. And after you've entered, you've practiced, and you want to renew your license, for an example, you need to be trained. You need to have the skills. Yes, we know that we go through a lot of in-service training, and we'll do the didactic and over and over a varieties of that. But are we practicing? Are we putting our hands to it to know if we are indeed competent, if we are indeed have improved our skills and knowledge? So you can see that is just a glimpse of how the ELAB will be. Where you see these computers, they are the control room. We have the technician, he sits there, and then he controls everything behind the glass. So people in the room, like it looks like a theater, they won't be able to see the technician, but then he sees everything. He sees everything that goes on. And there are camera mounted all in there that after every skill, after every scenario, after every practice session, you can be able to debrief. You see, oh, I missed this step and I need to work on it. ELAB equipment, you see the low and the high fidelity mannequins. For the past times, like I mentioned, we've been practicing with our low fidelity mannequins. These are mannequins that don't talk. These are mannequins that are just there. You break the mannequin, and you want to simulate some birthing, you have to use someone to be pushing the baby out of the uterus, like manual thing. But for the high fidelity mannequin, like we talk about the state-of-the-art simulation lab, we'll be using mannequins that can talk. We'll be using mannequins that can bleed. We'll be using mannequins that can give birth. So to not jump the gun, we got 4 different high fidelity mannequins that we'll talk about very briefly. You see the semen? The semen has all the cardiovascular and respiratory system. Semen will show that the blood pressure is low, will show you respiration, will show you heart rate, and can even respond to different physiological conditions. Semen can react to a drug. If semen is going into shock and you give semen epinephrine, you'll see semen jumping. That's semen. That is, you take your stethoscope, you listen to the semen abdomen, you hear different bowel sound. Unless the past, we just say, okay, instructor will tell you, hear this sound, you hear this sound. No, it's not about the semen. You will actually place your stethoscope and listen to different bowel sound depending on the patient's condition, depending on what semen tells you happening to him. Same baby, you will have venous access. You will have pulmonary, you will have the pulmonary, the cardiovascular, everything you listen to. The same baby will breathe, the same baby will have mucus, the baby will go in shock. You will need to do an I&O on the same baby. And the same baby will cry. The same baby will draw his arm to tell you that, oh, you're puncturing too much now, you know? Yeah. Nursing Ann has all the complete female genitalia. Nursing Ann has a uterus, Nursing Ann has a vagina, Nursing Ann has everything. You can use Nursing Ann to do any GYN assessment. Birthing simulator, this is one of my favorite simulators for each time I see it. This simulator will give birth, will give real-time birth. You won't be there pushing the baby out. You won't be there trying to help. You will be there doing the delivery, and the baby will come out of the uterus. The baby might come in some fourth-limb breach that you will need to do cesarean section, and the doctor will be called to do a cesarean section if the fetus cannot come up, depending on the presentation. The baby might come with cord prolapse. This is actual thing that will happen when the woman is pushing her baby forward. You see the cord coming. Usually they tell us that when you see the cord, you just apply NS and call the doctor, or you the cord around the neck when she's pushing through, you slip your hand down and try to feel if the cord is not that tight. You remove it or you clamp. So the birthing simulator will do all of those things. So it's not something you'll be like, is this happening or it's not? This is something that you will see. Are we excited about that? The control room, like I talked about, you see the technician at the back of the control room. He controls everything in the room. He controls the simulators, he controls the sound, he controls the visual, everything. And then whatever that is done in the room there, no one sees what's happening. Only he sees it and controls it. He makes the simulator to the mannequins to breathe, to cry, to give birth, and do the rest of it. After your simulation practice, you go in the debrief room to see what's happening. What did we do good? And in our setting today, we do debrief. We do. Clinical instructors, nurses, doctors, we do debrief. But we don't see what we're talking about. We just say, oh, you did not position the towel well. You did not cut the cord well. You did not do that surgery well. How? But for the experiential learning and assessment, high technology, state-of-the-art lab, you will be able to see everything that you did in the room. You'll be able to see everything that you did in the room. If you did not call your doctor in time, if you did not monitor your pathograph, you were just there trying, because we know that some of us clinicians, we always want to do all we can, even if we see that there is no progress. We still want to be there. The control, the screen will show it that at about this time, there was no, there was very increased contraction, but there was no descent, there was no cervical dilatation. But you kept the patient. Why? These are things that you will talk in the control room, and then you jot your points so that you can have a return practice. Are we there? So this is the flow plan. Later on at the end of this program, we will walk through the ELAB. This is the flow plan for the ELAB. The two simulation suites, we have two big suites. And before going to this, I really must, like the project directors and everyone spoke about, a very big thank you to the JFK and the TNIMA families. Can we give them an applause, please? They provided this space for us to use. It's not like your thing, it's our thing. We are clinicians and we need to use this space. So they provided this space and we are putting a space together. So you'll see these two big simulation suites. There we will find our birthing simulator, our Sandman, our Sand Baby. And then we have the two deep briefing rooms. After your simulation, you need to go back and talk. What did I do? Where we did well and where we need to improve. It's not something like we're just going to talk about. It's something that you're going to see. You're going to see, so, oh, I should have done this. And the ELAB is not just Dr. Kun and myself. We are a very big team, but we see small of us in front because they can shop us in front and say, y'all go do the thing, you're not in front. So Dr. Kun, myself, and George, the technician, you in the audience, please. George, can you stand up? So, and we also have our very, very strong partner, the Vanderbilt Medical Center, University Medical Center, Dr. Marie Martin, please. These, Dr. Montra Mohai, he's not here. Dr. Anna, she's not here. Anne Green, these are our technical partners from Vanderbilt. And the man behind all the program here, Chase. Thank you very much. Like I said, we have our ELAB team, we have our faculty representative, wherein we have our steering committee. There are lots and lots of people part of our steering committee. Our Honorable MC, she's a part of the steering committee, and we have a lot of other people from the TNIMA, from the medical unit, from pediatric unit. If you are in the room, can you just wave to us, please, our steering committee members? These are our backbones. These are the people that make things happen today. And we also have some institutions that we work along with that we're supposed to be going to for training. The Kejabi Hospital in Kenya and the Benin State University. We collaborate with these people because, like I said, the state-of-the-art simulation we're talking about here, we've never done it before in Liberia. From 1847 to now, we've not done it. So in order to be able to do it, not just to guess, not just to try and see how it will work, we need to be trained. So we'll be going to the Kenya and the Benin State University for training. So where are we now in the progress of the ELAB launch? Where are we? We have tried and we have done a lot of good things. Once again, to the JFK family, for each time I think about space, I'm like, thank God for JFK. JFK is the mother for us, right? So thank you again, JFK. JFK gave us space, but then we need to turn the space into something. We need to turn the space into something. So we have the space. LMDA, Alumni Association, give us some money. Can we give them a hand of applause? LMDA here, Alumni Association, hello. LMD, AM Doklati Alumni Association. Politics will not enter. So we also We have equipment like the mannequins, computers, and what have you. We've gotten some, and the staffing. You need staff, you need space, you need resources. So you can have your space, you can have your resources, and you don't have staffing to make the space functional, it won't work. So we have our full ELAB team, which includes our steering committee and training. We need to be trained. We need operation. How will the ELAB run? Now we have the ELAB, we have these state-of-the-art mannequin. How will it run? Who will sponsor it? We need staff, we need stuff, we need space, we need system. So how can we have this going on? So from now, these are things that we've worked on, and we can say that we are at a certain stage, though we're not complete. Okay with the space because we are still renovating. We're now full with our equipment. Dr. Kun always tell me, I say we got to make sure we get all our mannequins within the 5 years, because this is a donor project. We don't want to enter year 6 and 7, then we don't have mannequins, because some of these mannequins cost like 80,000, 120,000 United States dollars. So where we're going to get the money from? So she'd be like, let's make sure we get up. Be like, okay, we'll try. So it's just a very short one to just take you through the space that we have. So here is like a debriefing where after your simulation, people come on a table and talk about what did we do right, what did we do wrong, how can we improve it. Then we enter into the simulation room where the happenings, where we have people going to shock, we have people getting medication, we have mannequins giving birth. This is just the suite. At the end of the program, we will walk through and you will get a better view of the place. And in the near future, you'll be, I know somehow, will be like, is this the space that we're talking about? This is our starting point. Like Dr. Kon always said, this is our starting point. We shouldn't get too comfortable in here. We should think of ways that we can erect a state-of-the-art simulation, wherein when it's visualized somewhere or someone reads about it, be like, I have to take my institution to Liberia to do experiential learning and assessment. So we are not just comfortable with that space, we are just squatting, because we know in a few years' time, we want to get into a bigger space. Our short-term goals. We want to complete the lab. We want to install the mannequins and equipment. We want to get training. So the ELAB team will be trained somewhere between July and August. And then our faculty team, we are hoping that the team be trained in Benin State University in August. With all go back to zero. So we should also be thinking about sustainability plan. How are we going after the 5 years? What are our thoughts? We are having 5G simulation. We also need 5G. Not only to have the mannequins, 5 going to sustain this? Because we know Liberian sustainability, our issue. We're good at talking, we're good at planning, we're good at having the actual thing. But then, do we want to become donor reliant? Do we want to become aid reliant? Instead of somebody washing your belly, you wash your back, right? So we want to think how we can strategize, how we can plan to continue this. So thank you very much once again. Before we can end this section, we'll entertain few questions or addition, just one or two, to think about sustainability plan. So Dr. Kwon, you want to come, please? Dr. Kwon and myself will be here to just answer two questions if you have any, because after here now, though the MC has the master copy, we'll be doing simulation demonstration with low fidelity. So if you have any thought on simulation or way of sustainability, just two persons, and Dr. Kwon will respond to you people. Do you have any? Okay.
First of all,
Okay, let's put our hands together for Dr. Kuhn and Mr. Dolo for taking us through that very detailed preview of the simulation. At this time, we will turn to Mrs. Bala for a demonstration of the low fidelity simulation. It will be, yes, it should project here.
good afternoon. So you'll be projecting it? Okay. So I want to say thanks to all of our donor partners. And I want to say a special thank you to my CEO, the CEO of our time. The president calls him Rolando and C-Boy. That's how he calls him. He's one of those that don't believe
After gathering your materials, you should be able to do hand hygiene. You do hand hygiene. And put on your disposable gloves because you got to keep safe and keep serving. After doing that, you should be able to do what? To apply tourniquet, right? So that the vein will be prominent. And ask the patient to what? To form a fix. After forming the fix, you should be able to disinfect the area before you go about to do your procedure. So for this today, we are going to do our demonstration. And right after the demonstration, I will have one student to be able to do return demonstration. Do we have any questions, student? Can we go ahead to do our demonstration? All right. So, in gathering our materials, we need 5cc syringe, right? With a needle. And we need our swab. We need antiseptic to be able to swab over the vein. And we need our tourniquet. So, Axel, please turn around to help me. So we are using our tourniquet, right? To be able to have the vein superficial. Okay. So I'm trying to open the syringe. And then take my swab. Okay. I swab, put it down. Put it down. I'm trying to get into the vein. Getting into the vein, you make sure you have the beaver pointing upward. And then you go 15 to 30-degree angle. And then you collect 5cc of blood in the syringe. This is the back flow. And before you take the needle out, you should be able to release the tourniquet. If not, you have a lot of splashes on your skin or on your clothes. Then you take the needle out and put a tip and put a sample in the test tube. And put this into the sharp box. And put a tip here and make the patient to be here for at least 5 to 10 minutes to control bleeding because some are bleeders. And take the specimen to the lab for laboratory analysis. For diagnostic tests. Okay. Put it on. Please cut another one. So he's cutting the tape to control the bleeding. It's okay. All right. So, students, do we have any question? This is the end of the procedure, and I will ask one of you to be able to do return demonstration while doffing on my gloves. Okay. So, as you're taking your gloves out, this is how you do it, so that you can contaminate yourself. Okay. After that, you re-synthesize your hand. All right. So this is about the procedure. So one student will do return demonstration.
Okay, my name is Isaac Rube. I'm a student nurse, and I will be doing a return demonstration. As my instructor said, before you start, you have to disinfect your hand, which has to do with the first step. So I'm disinfecting my hand. After I've done that, okay. This is Mr. Flumo. Mr. Flumo, I'm student Isaac Rube. When I came this afternoon, I saw the order in your chat that we should collect a blood sample for testing in a laboratory. So, and I'm sent to you. If you have any question, you can ask me. So I gain consent from a patient. Right now, I'm about to perform the procedures. Before I start, I will perform my hand hygiene first. All my necessary materials are gathered. I put on my disposable gloves. After putting on my gloves, I will tie the tourniquet around the arm so the veins will be prominent for vision. So I'm tying the hand. Then from there, I'm using an antiseptic swab to disinfect the portion which I will insert the needle. Swab. You can swab 2 or 3 times depending on the skin. I'm taking a dry cutting to wipe out the fluid to avoid contamination of the specimen. I take my 5cc syringe, and this is there. I'm opening it. Dispose the pack. I remove the cover of the needle. I make sure the beaver of the needle is upward to the calibration of the syringe. And I direct my needle 15 to 20 degrees. I advance. Pull back. The backflow is here as well. And I'm not taking off my needle. I take off dry swab, apply it to the site, and then remove my tourniquet. After I've done that, I take off the specimen and place it in the test tube and send it to the lab for the testing. I discard the needle in the sharp bags. I apply tip. Yeah. Yeah, but I'm compressing it to stop bleeding. After I've done that, I remove my gloves outside in like this and discard it. And then observe my patient for 5 to 10 minutes because some have bleeding disorder. Thank you. And I perform my hand again. And I appreciate my patient for the cooperation. Thank you.
So this is the end of our demonstration for the day. You have done well, students. I appreciate you to continue practicing more and more.
Great job. Let's give a round of applause one more time for the wonderful teacher and the very attentive students. So this is what is going to be happening in the simulation lab. And this is a wonderful time for learning in our country, and we look forward to this experience. At this time, as I do have the master copy, and I like to say by popular demand, we will have a selection. We'll have a selection by Dr. Kuhn. Everybody put your hands together for Dr. Kuhn.
And Dr. Batikwa. Great is thy faithfulness, O God my Father. There is no shadow of turning within. Thou changest not, thy compassion, they fail not. As thou hast been, thou forever will be. Great is thy faithfulness. Great is thy faithfulness. Morning by morning, new mercies I see. All I have needed, thy hands have provided. Great is thy faithfulness, Lord, unto me.
Pardon for sin and the peace that endureth. Zion, dear presence to cheer and to guide. Strength for today and bright hope for tomorrow. Blessings all mine with 10,000 beside. Great is thy faithfulness. Great is thy faithfulness. Morning by morning, new mercies I've seen. All I have needed, thy hand have provided. Great is thy faithfulness, Lord, unto me. Dr. Kuhn, everybody. Thank you so much, Doc. At this time, without further ado, we'll now take remarks, starting with the A.M. Dogliotti Alumni Association.
Good evening to all. At this time, the president or representative from the University of Liberia here present, the vice president for the University of Liberia College of Health Sciences, our partners who have worked tremendously that we are here today, not to forget the USAID, and also member of the Alumni Association of the A.M. Dogliotti College of Medicine, and one of our earlier president, Dr. Macaulay, to recognize her, and to all of those who have made it possible for us to be here today. It's an honor to be here representing the A.M. Dogliotti College of Medicine Alumni Association to join the University of Liberia College of Health Science in launching the Center for Teaching, Learning, and Innovation, which we see the ELAB is a portion of that activity. It's a great pleasure to be here and to have the opportunity to make few remarks on behalf of the association on this wonderful day, marking the official launch of the ELAB and seeing a demonstration which is just a pinch of what we expect to see. We want to use this opportunity to say thank you to Dr. Dan, our former Minister of Health, Republic of Liberia, and the Vice President for the College of Health Sciences, for taking up all other things to come and serve for alma mater. We know as she was minister before, other people will decide to take other bigger job or go somewhere to rest. But she thought it was necessary to come back and give back. Because sometimes when you are a student and you see teachers, sometimes you just feel they are in a teaching position, or because people at the ministry always say they are in a ministry, they are in the big offices and they don't know why we are going through. But today she showed that she is humble because she had left her office, the high profile, and today she's with the college to ensure that we improve on what is already existing. So I want to thank you, Dr. Dan, and your hard-working team, Dr. Kuhn and I say who have been working with you, and all those who are working with you to make the day of success. I think in the future, when they talk about ELAB, I know we remember Dr. Dan. And all those who are working with her. So we want to say thank you. As an alumni, we know our goal is to make sure that we give back. We all have benefited from the free tuition. We went to school where we did not have to pay a dime. Teachers were there to teach us. And especially for some of us who enter when the government launched, they initiated the US $200 monthly allowance for students. And we all benefited from that initiative. Going to medical school, it means a whole lot. Where you have to leave another thing, even teaching on the side was a crime when you're in medical school. Once you are caught teaching, it seems as though you are not serious. And so you will have to leave basically everything to go to medical school. How do you survive? But because of that, a lot of students, a lot of doctors are here today. And we say we are doctors. We are proud to be doctors because of that initiative. And I still remember Dr. Dan as minister. So we want to say thank you. And so as an alumni, our goal is to help to give back to our institution. And giving back to our institution is not just about the 2 years rural service, where we will go and after the 2 years, we are running and troubling the Ministry of Health of the government of Liberia. It's not about upgrading our incentives afterward. It's about making those sacrifices. It's about going in a rural area to work without making unreasonable demands. It's about being there when we have to be there. To show to the government of Liberia, to our partners, that there is reason to continue the tuition free for doctors and other cadre of practitioners. And also to employ them, to put them in the employ of government after graduation, that we will not have to go around fending for jobs. Sometimes the people the leaders get afraid of us because we give them too many demands. And because of the too many demands, it turns to also haunt us. But we believe as doctors, we will serve and show that the government made no mistake to say they should not pay fees. You made no mistake to say we will get $200 compensation. So there's a charge as graduates to make sure that we prove that that system must continue. During the 50th anniversary of the A.M. Dougherty College, we had series of activities, and thanks to the steering committee of the 50th anniversary, who was chaired by Dr. Selina, we have other doctors and health professionals joining us to celebrate the 50th anniversary. And one of our goals was to raise funding that will come back and support the institution. And one of those activities that were earmarked was to support the College of Health Science in establishing the ELAB. And during the activity, we had a dinner, and that dinner, I actually felt to mention Mrs. Lehman Bowie, which was our chief launcher. When we were looking all around for somebody to be the chief launcher, we could not lay hands. And in a dying minute, Dr. Dan said, I will come and help you. And then she picked up her phone and called Mistress Bowie. And then she said, wow, it's too late. But yet she consented. And she took it as a priority to be at the launch. And it was very successful. And we were able to raise funding. And when we're talking about raising funding, I know some people still owe me. So, don't be surprised. We still need our money, and we still need more money to support this worthy cause. So don't be surprised if we come back at your door knocking. We still remember the pledges we are putting together to come to you. And once you make a pledge, if you know you make a pledge, that comes slowly. and pay. But we will still come and collect it, and we will share the listing. Also, sometimes maybe if you see Dr. Dan calling you and say, you owe the school, you owe us, it's because we're going to share and see how we can collect the money to be able to contribute to why we're starting today. So I want to say thank you to all those who have contributed, who work. We have already gave our initial contribution, and we are still there. So all alumni, we will still strategy that to see how we can raise more money to continue to support this endeavor. So we know time is fast spent, so not to take much of our time, we want to at this time say thank you to our partners who have worked hard to make this day a success, to the University of Liberia College of Health Sciences, to all of our hard workers that are in her team, to the all members of the Alumni Association, and I know all those who contributed, you know that you contributed. We want to say thank you, and let us work as a team to ensure that our alma mater once more become first in our region, because we know before, like now, people go in Ghana, they used to send to our JFK. So let us work together. Now we want to use this time that we will try to make the Alumni Association more visible to the school, that will be able to work in collaboration so we can be able to make our school first to none. Thank you, and God bless us all.
Thank you very much. That was the AM Doug Laerty Alumni Association. We'll now take the Liberia Medical and Dental Association.
Permit me to stand on the previous protocol to just bring you warmest greetings from my dynamic boss, the president of the Liberia Medical and Dental Association, Dr. Alberta N. Clark Colley, and the rest of the officials. We are here today, and we are very gratified to have been a part of this process. It happened not as planned as the Alumni Association was involved, but I think it happened for our good that we got involved. Our involvement as the Liberia Medical and Dental Association came from a rather sad event that we lost one of our best brains in person of the late Dr. Samuel Bowman. He happened to to have become the first medical doctor trained in Liberia as a Liberian. So when he passed, there was this, being a member of the Liberia Medical and Dental Association and a very, popular and astute mentor for many of us, we thought it was indeed prudent to have a memorial and to do something to memorialize him beyond his days. So it was against that background that the Liberia Medical and Dental Association rallied some contributions. The money collected was splitted. Some went to the family to take care of his passing ceremonies, and the other half of the money was kept to be given for any initiative that would have had his name inscripted. So with further discussions, the University of Liberia already had a plan to develop this lab that is a dream for all of us now. And so we were very glad to have collaborated and to have made contributions. However small the contributions are, we are glad that we are partnering with all those who are making this great, great, great monumental project to become a reality. So on behalf of the Liberia Medical and Dental Association, we bring you greetings and we say thank you to all of the partners who are doing everything they can to make this a success. Thank you to all of our doctors who contributed the little penny. Today, we gladly see our beautiful logo up there, and it was just because of the little contributions we made. So thank you very much. and I wish us well.
Thank you, Dr. Zia, on behalf of the Liberia Medical and Dental Association. At this time, we'll have the Liberia College of Physicians and Surgeons.
Standing on existing protocol, I'd like to greet every one of you. From the Liberia College of Physicians and Surgeons, where Professor Benjamin Harris is the president, I was asked on behalf of our second vice president of the Division of Physicians, Dr. Sia Watakamano, to make a brief remarks. I want to join the president of the Alumni Association of the Medical College to thank Dr. Bernice Dan in his public manner. The idea of establishing a College of Health Sciences has made a great difference with respect to learning in the arena of science in this country. It couldn't have come at a better time. We have learned a whole lot, even some of the things that we should have learned before, we've just learned that. So I want to say thank you very much that the establishment of the College of Health Sciences have added a new dynamism to learning. We want to thank our, I wouldn't say partners, maybe I would say donors, because they keep helping us and they continue to keep Liberia on the radar to know that we are a country in need, in special need, and they continue to help us. We're very much grateful. We are grateful to all of the different institutions of health in this country for the partnership that continue to subsist amongst and between them. It couldn't have been done by any one person. The collaboration makes all of the difference. And we see that we today is such a great excitement to see us having an ELAB. When we're in medical school, we just used to imagine a whole lot of things. Oh, they got something they call CT scan, they got something they call MRI. But at least now we are able to work with different institutions in the country and see them, and that makes learning a whole lot easier. We're also proud of our young professionals like Dr. Kuhn, Dr. Balo, and the others that are on board to make sure that they help the upcoming professionals. We are also grateful that it's not only the doctors that we have, our nurses, our PAs, and everybody on board. So I want to say thank you very much for this wonderful opportunity, and we know that within the next 2 months we'll be able to walk to an ELAB and see it and touch it and feel it and make learning easy for all of us. Thank you very much.
Thank you, Dr. Andrews. Now we will have Ministry of Health.
Good afternoon, everyone. Let me stand on the existing protocols. My name is Diana Tanasate. I'm the Chief Nursing and Midwifery Officer of Liberia. I would like to take this time on behalf of the Minister of Health, Dr. Wilhelmina Jara, and in my own name, a position as the Chief Nursing and Midwifery Officer, to say a big thank you to Dr. Dan and her team who have come up with this great initiative. It is very important because we have a serious gap in the hospitals, in our health facilities, with competency skills with our nurses and our midwives, and even the doctors and PAs. So the other day I was sitting and I saw a text on my phone and it said, "Oh, Dr. Dane, come and open the TNMA lab and only doctors will be going in the lab." I said, "No, Dr. Dan cannot do that. Dr. Dan is not that person." When they talk about competency skills, it's not only the doctors that perform competency skills on patients. It is also the nurses and the midwives. And we know we have to improve the healthcare system in our country. So definitely the nurses and the midwives are going to be a part of this. And I'm so excited today that we will have the first of its kind state-of-the-art ELAB. I want to say thank you, Dr. Dan. Can we give a big hand clap for Dr. Dan and her team? So, Dr. Dan, I will say in this public manner, we want to congratulate you. The Nursing and Midwifery Division, especially, is so proud of you. I know you were fooling us the other time because we carried the other Tommy here and said, well, we're coming to open ELAB. But not knowing that was just something on the surface. But we are proud today that she has thought about it and she wants to improve the healthcare system in our country. And we are so proud and we are willing to support whatever that has to do with providing quality care to our patients. I want to say thank you. The only thing that I have issues with is that I'm not seeing the board involved in this. I listened to the presentation here and I heard my brother saying, as nurses, midwives, you will come and perform and before you get your license. But I'm asking to please collaborate with the regulatory board, the nursing and midwifery board, because they have this platform where nurses can go and to their competencies, skill. They have a platform where CPD, right, Rosalie? And then they get their license. So collaboration, I know she has been doing it. Maybe today is an oversight that they are not here. But I want to say congratulations to every one of us, and we hope to hold together and improve the healthcare system in our country. Thank you very much.
Thank you to the Chief Nursing and Midwifery Officer of the country. Last and by no means least, and you know the saying, they keep the best for last, we will now have our own CEO of the John F. Kennedy Medical Center, Dr. Jerry Brown.
Good afternoon to all. Please permit me to stand on existing protocol. The John F. Kennedy Medical Center is more than excited to be part of this history-making event. And so I want to say thanks to all of you for, especially our partners. A lot have been about former Minister Dr. Dan, former doctor as well. Happy that she will play a significant role Before I go further, to share a joke with you concerning one of my doctors who encouraged me to become a surgeon. When I was rotating with this doctor at the OPD, there was one thing the doctor was fond of. There's no way you will rotate with this doctor at the OPD without putting your finger. There's no male patient who enter that OPD room and you don't do rectal exam. No way. Whether it's a normal prostate or abnormal, she will do a rectal. I try not to call sex, but the doctor will always do the rectal exam and ask you, put your finger. Initially, as a medical student, I disliked doing a rectal exam. But I later realized how important it was. Because there we've got to recognize first the abnormal prostate from the normal one without seeing it. When it came by repeated exam, you appreciate the normal from the abnormal. When we went to postgraduate training, I felt several normal. Okay? Because you're not looking. It's your finger that will communicate with your brain. And so the establishment of this simulation lab, I want all healthcare providers to know it is not only for students.
It's for both healthcare provider and students. We think JFK that it is ideally located in that most of our medical training institutions come for rotation at JFK. The medical school, our only postgraduate training institution, our own TNIMA, and many other nursing institutions. They all come here for their clinical practice. Besides, there are many of us doctors who never had the opportunity of having simulation near our medical school sojourn. It's another opportunity for us to take advantage of what has been established here. So it's not a student thing. It goes beyond the student. One point I want to put forth to our partners is that we should all strive to ensure we have this lab expanded beyond what we currently have. Given the fact that simulation cuts across, I know many of the things that were presented relate a lot to obstetric. Well, let's begin to think about other professional entity other than obstetric to have them involved. Like if you put in an implant in a bone, develop some form of simulation that our doctors will improve their orthopedic skill in splinting a broken leg. It's like expanding it beyond what we currently have as we move ahead. I was happy with the vision that one of the previous speakers put forth, that this is just the beginning. We look forward to having a lab much bigger and better than what we currently establish. That's a good vision. And for us, JFK, we give you all of the support that we can provide to get it done. I know Dr. Kuhn hasn't been easy from the beginning. I remember saying to her once upon a time that JFK is not a balloon. It was an establishment that I inherited. And so asking me for more space, I can pump the balloon to create space. I have to displace order in order to give you space. So we have to lobby and negotiate so as to convince the students themselves as we displace them. I'm happy that they are within this hall today, because initially they felt we were coming up with something that would not benefit them. They felt left out. And so there was some form of dissatisfaction among them. But with them being here today to listen and visualize some of the things that happened today, I'm certain they know that this is going to benefit them the most. So we want to say thanks so much. Today being the Public Service Day, celebrating Public Service Day in Liberia, we are urging everyone in here to see how best we can work together to sustain this good work. As I'm sure one earlier speaker said, sustainability is going to be key. After 5 years, what next? We hope we can all put together policy, guidelines that others coming after us will adapt as we leave. Continue to say, I've visited many health institutions abroad and other places. The major big those places in policies and guidelines and people adhering to it is lacking our setting. Have written policies, have guidelines, and they adhere to them. Once we can come up with good policies and guidelines on how to run that place,
and ensure we are abiding by it from the beginning, irrespective of who you are, we will sustain it. If we begin to carry our Liberian thing, don't you know that I'm the CEO? Why should I do that? Then we'll spoil it. But as long as the CEO himself knows that this is the guideline and we abide by it, and the other students and doctors are abiding by it, we'll go a long way. That's a big challenge I currently continue to experience as head of this entity. Beside that, for all of, especially for us in higher position, we are often the biggest challenge in the people in the grassroots. If we all learn to abide by policies and guidelines we put down, others will follow. They only want to see us in leadership following, and they will follow. Again, thanks to the Vanderbilt. Is that the right pronunciation? Vanderbilt University. Thanks to the EMWT Alumni Association. Thanks to the Ministry of Health, the World Bank, PEPFAR, HRSA, and all partners who have contributed to make this dream come true. We'll work with you until it becomes a true reality. Thank you.
Thank you, Dr. Brown. At this time, every good thing must come to an end. And so I'd like to, on behalf of the organizing team, give a vote of thanks to the ELAB coordinator and the deputy director, Mr. Dolo and Dr. Kuhn, for the hard work in organizing this occasion. I want to thank the TNIMA, the University of Health, University of Liberia College of Health Sciences. Thank you to Liberia College of Physicians and Surgeons. Thank you to the John F. Kennedy Medical Center. Thank you to the students for being present. Thank you to Vanderbilt University and to all the partners that have been mentioned here. Thank you for leaving your busy schedule to be here today. Before we bring this session to a close, we are going to have a tour of the ELAB, the space that is undergoing renovation, where the lab will be housed. And so we will follow the coordinator. Okay, we'll grab a snack from the back and then come to the front. They will lead our guests and coordinators will be first to lead a line. So we'll start from the front. As you go and grab a snack,